Hello, everybody. Thank you for joining us for this very important conversation. Get proactive in understanding your sexual health. I am Shuba Visweswaran, the head of brand at Proactive for Her, which is a women's healthcare company that offers judgment-free, personalized, and confidential healthcare solutions online, at home, and in our clinics in Bangalore. I have with me the wonderful Dr. Ankita Gharge, a gynecologist and PCOS expert at Proactive for Her. Her areas of specialization include irregular menstrual cycles, PMS, UTIs, sexual health, and contraception. And she believes that patient care is best provided when there is good communication between her and the patient, so she can provide accurate, evidence backed information and treatment options. Welcome, Doctor.
Hello. Thank you, Shubha. Thank you for having me here.
Yes. So it's so important to speak about sexual health, and we applaud Policybazaar for taking the initiative to present this important conversation. Being proactive about your sexual health allows us to make big choices and decisions about our lives, including when and whether to consider having children. Decisions about our lives, including when to have children. It includes everything from vaginal health, fertility, contraception, PCOS, avoiding STIs or sexually transmitted infections, and preventing certain cancers, very importantly. Doctor, have I missed anything?
I think, Shubha, you covered all. And preventive health. I think that is what we are missing nowadays. We think about our health when we are not healthy anymore. So, why not we think about it when we are as healthy as we should be? Okay, so that is preventive health. And I think you and I are going to talk more about that today, right?
Yes, yes, very, very important point, and I think that's what we at Proactive believe very strongly. So I thought we could start with an area that I know you doctors always get so many questions about at Proactive, and that is around vaginal discharge. Can you tell us a little bit about maybe what is normal vaginal discharge throughout the menstrual cycle, and then tell us what isn't?
Yeah, I think that's a very good opening question because vaginal discharge is something which is, bothering a lot of women of reproductive age group and otherwise as well. And that is what we see most commonly into our OPDs and into our online consultations as well. So today I'm going to just discuss and let you know what normal vaginal discharge looks like. Okay, so normal vaginal discharge changes its color, its consistency throughout the cycle. So if you consider that you have a 30-day cycle, so in the first half, so like when you are bleeding, when you have your periods, the discharge is supposed to be blood, right? And the blood is definitely reddish maroon in color, and it should not be associated with more than coin sized clots, right? So that is what is normal during your periods. So if you can have your periods for 5 days, for 7 days, for 8 days, depending upon what your cycle looks like, right? And in the first half of the cycle, which is your follicular phase, at that point of time, the discharge, it increases and becomes a little more liquidy, little bit mucusy, etc. If you try and hold that mucus, it will just go, as long as you can stretch it, right? So that is more stretchable. And during your ovulation, the discharge becomes, liquidy as much as it can, right? And in the second half of the cycle, it starts becoming thicker, right? So in the first half, it is more liquidy and mucousy. In the second half, it becomes more thicker. And as you reach getting your next cycle, which is your periods, the discharge again becomes enormous in quantity, and it again starts becoming liquidy. It is all because of the hormonal changes which are happening inside our body, and that is responsible for changing the consistency and color of this discharge. So color, desperately, it is reddish during your menstrual cycle. During follicular phase, it is transparent. During your ovulation, it is more creamy white. During your second half of the cycle, which is the luteal phase, it is more of whitish transparent. And in the end, just before your periods, it is more liquidy and transparent again. So if you're observing that, this is your color of discharge throughout the month, this is absolutely normal. So then what is abnormal, right? Because we don't know that if this is normal or not normal. So if you think that, my discharge is associated with very foul smell, like many people come to us with fishy odor, like it's smelling like I'm I'm just out of a fish market, right? Or it is very pungent, or it is very strong odor, then that is absolutely indicative of an infection and you should see a doctor. If it is associated with itching, redness, burning sensation, and any rash over your vulva or inner thighs, that is absolutely indicative of an associated infection. You should not be ignoring it. Make sure that you're talking to your doctor, reaching out to a doctor, and taking a solution for the same.
Thank you. Thank you, Doctor. I think that's really important. I know lots of women are concerned about the vaginal discharge and don't know what's normal. So that was really helpful to clarify. I think along the same vein, let's talk about intimate hygiene, because when the discharge is normal, I know sometimes women are sold and marketed a lot of products that promise to keep us fresh and clean in our intimate area. And, I've heard from you all, the doctors, that the medical advice is that it's completely unnecessary and really not safe almost, right? Not safe. So can you tell us a little bit about why we shouldn't use these intimate hygiene products and maybe what we can do instead?
Yeah. I think again a good question, Shuba, because many people come to us after seeing much more ads, and because of the AI algorithms over Instagram and Facebook, we are actually having ads of a lot of skin lightening products. So they come to us and asking, if I use this product over my vulva, will my vulva become fair? Okay, so I wanted to tell you all that our vulva is supposed to look in a way because of the hormonal changes. So the skin over the vulva is definitely more darker than your other, skin of the other parts of the body. Why? Because of the hormonal changes, which typically start, during your puberty, and it is supposed to look like that. It is not supposed to look like maybe fair or what is shown in the pictures or on the anatomical diagrams or all over the internet, right? And what can these cream do? So these cream can have bleach or any chemicals which can definitely harm the skin over there. So the skin over the vulva is much thinner than the skin which is present over your thighs. So if you apply any cream, it can definitely react adversely. You can have some rash, you can have redness, and it can cause more hyperpigmentation over that area, right? So make sure that you are not indulging on the advertisement of it, making sure that you are talking to your doctor, asking for whether this will suit my body or not, taking their opinion, and then only going ahead and using that product. Second thing which is marketed more commonly is the intimate wash. And why? They feel that my vagina should smell like flowers or smell like strawberry, again, which is why all these intimate hygiene washes are just marketed blindly. So when you are using any intimate wash, and if it goes inside your vagina, or if you're using any perfumed or perfumated product and it goes inside your vagina, it is definitely going to alter the pH of the vagina. So your vagina has typically an acidic pH, and it is meant to be that way. Why? Because then it protects the vagina from harmful bacteria and viruses, right? And if you are changing the pH, it actually loses its power to kill all that bacteria and the pH, and will make you more prone for infections, right? And it is also one of the causes of recurrent infections. So if you're falling prey to all of these products, you can definitely fall and become more prone for having these infections, right? So make sure that you are not using or just overburdening yourself with these products. Ask your doctor. Okay, we are very user friendly, right? We can definitely suggest you ways which will keep your intimate part more hygienic, and we can suggest you ways through which you can actually feel more healthy down there, right? And do not use do not believe all those products blindly. Trust us, and definitely we'll guide you to much more healthier products.
Yeah, thank you for that. I think sometimes it's very hard as women, when we're being marketed so many different things, we assume there's some science behind these things, and in fact they're not regulated at all. And so I think a blanket not using especially whitening products or any kind of intimate wash is really good to know for women. So thank you for explaining why we need to stay away from those products that we're marketed to. Another common concern that women have is around UTIs, or urinary tract infections. And I think they're one of the most common infections, if I'm not mistaken. And I mean, I think some 25% of women have at least one in their lifetime, and many have recurrent UTIs, and it becomes a real problem. Can you talk to us a little bit about maybe why they're so common in women more than men, and what are the symptoms and risk factors for that?
Yeah, so definitely I would love to share more on this topic. Also, Shubha, sorry to interfere because many of the comments say that we should also be speaking in Hindi. So I'll just try and merge both of the
Please,
languages and try and
please
speak
go
the
ahead.
symptoms out. Okay, I'll try myself best. So UTI यानी कि आपके पेशाब में जलन होना या पेशाब का इन्फेक्शन होना, ये सारे इन्फेक्शंस बहुत कॉमन होते हैं औरतों में, मर्दों से ज्यादा कॉमन औरतों में होते हैं बिकॉज क्योंकि जो हमारा यूरिन का ट्रैक्ट है या फिर जो उसका पाथ है वो औरतों में कम है मर्दों से, ठीक है. सो इट्स लाइक लेसर इन सेंटीमीटर एंड लेसर इन लेंथ देन इन मेन. ओके, सो इफ आई गिव यू अ कंपैरिजन, अगर मैं कंपेयर करना चाहूँ तो औरतों में वो 4 सेंटीमीटर है और मेन में वो 10 सेंटीमीटर है. तो अगर एक बैक्टीरिया चाहेगा 4 सेंटीमीटर चढ़ना तो डेफिनेटली वो चढ़ पाएगा, बट अगर वो एक बैक्टीरिया चाहता है कि वो 10 सेंटीमीटर चढ़े तो वो कहीं तो थक जाएगा, राइट. सो इट इज, या फिर वो यूरिन आ जाएगी, वो फ्लश हो जाएगा, राइट. सो इट इज much more commoner in in women to have a UTI than in men. Also, the second more anatomical feature जो कि prone बनाता है women को infection होने से is because women have a wider area of genital parts, right. उनका बहुत खुला हुआ genital area होता है. Vulva is more wider than men. Okay, for men it is not more, the surface area is not more, right. So which is why they are exposed to more particles, right, and which is why it is more prone for a woman to have UTI than the men, right. And which is why I think women suffered more. Okay, and because after sexual activity, right, there is exchange of bacteria, right. And अगर हम एक women की anatomy imagine करें तो जो यूरिन का पार्ट है, जो वजाइना है और जो एनस है, इट्स वेरी क्लोज टू ईच अदर, राइट. एंड ड्यूरिंग सेक्सुअल एक्टिविटी देयर आर मच मोर चांसेस दैट द बैक्टीरिया कैन गेट डिस्प्लेस्ड नियर फ्रॉम द एनस टुवर्ड्स योर यूरेथ्रा, राइट. तो वो अपने आप वहां पहुंचा रहा है और वो अगर आपके यूरिन पाथ में चला गया तो डेफिनेटली आपको यूटीआई होने के चांसेस बहुत ज्यादा हैं, right. So that is one of the other thing. Also, during pregnancy, क्योंकि ऐसे हार्मोन सिक्रीट होते हैं जो हमारे यूरिन को थोड़ा सा जो उसका मोशन होना चाहिए, सपोजली अगर वो 100 किलोमीटर पर आवर की स्पीड से चलना चाहिए तो वो थोड़ा सा 50 किलोमीटर पर आवर की स्पीड से चल रहा है. सो दैट मेक्स इट, क्योंकि वो धीरे धीरे चल रहा है तो इन्फेक्शन ज्यादा बढ़ सकता है. सो देयर इज मोर चांस कि उस टाइम पे इन्फेक्शन होने के बहुत ज्यादा चांसेस है. एंड दिस ऑल्सो कैन मेक यू प्रोन फॉर हैविंग मोर रीनल स्टोन्स, राइट. सो विच इज वाई these all, if you combine, it makes a woman more prone for UTI than a man. Okay, and which is why I think we should be more more I think aware about the symptoms. And I think अगर आपको कोई भी इनमें से symptoms समझ में आते हैं जो UTI या फिर यूरिन के इन्फेक्शन की तरफ पॉइंट आउट होते हैं तो फिर बिल्कुल भी आप उसे इग्नोर ना करें, डेफिनेटली आपके डॉक्टर से जाके सलाह लें.
So thank you. What are some things women can do then to prevent UTIs?
Yeah, so I think all the factors which I told you that are making you more prone for the infection, right? जैसे कि अगर आपको पता है कि आप मोर प्रोन है इन्फेक्शन के लिए तो मेक श्योर कि आप बहुत ज्यादा पानी पिए. अगर आप पानी पिएंगे तो डेफिनेटली कोई भी बैक्टीरिया अगर वो यूरिन पार्ट में है तो वो फ्लश आउट होने में हेल्प होगा. या तो अगर आपके बैक्टीरिया में आपके ब्लैडर में अगर बैक्टीरिया ग्रो हो रहा है, अगर आप पानी पिएंगे तो फ्लश आउट हो जाएगा. सो विच इज वाई वी डॉक्टर्स टेल यू एवरी टाइम दैट ड्रिंक मोर वाटर. ओके, it is not only going to make your skin better but also going to prevent you from UTIs. Okay, second thing is हम लोग क्या करते हैं, because we all are into corporate worlds, right? We're sitting in front of the computers for 10 hours long, 12 hours long, or we are traveling. Okay, and we try and avoid using washrooms for many reasons or reasons best known to us, right? And which makes us more prone for having the infection. So हम लोग क्या करते हैं, यूरिन है ना बहुत सारा कलेक्ट कर लेते हैं ब्लैडर में, एंड अगर उसमें इन्फेक्शन है तो डेफिनेटली जिस जगह पे स्टैग्नेंट है वहां पे वो ज्यादा ग्रो करेगा, तो इट विल डेफिनेटली मेक यू मोर प्रोन फॉर इन्फेक्शन. सो make sure that you are not holding on to your urine for a very long period of time. Go and pass urine. Okay, second thing. Third thing is, if you have any chronic disorders, like अगर आपकी शुगर ज्यादा है, आपको डायबिटीज है, हाइपरटेंशन है, हाइपोथायरॉइडिज्म, या फिर आप कोई ऐसे ड्रग्स ले रहे हैं जिसके आपकी इम्यूनिटी कम हो जाती है, या तो फिर आपको बहुत दिनों से इन्फेक्शन है, तो ये भी आपकी इम्यूनिटी कम कर सकता है और आपको यूटीआई दिला सकता है बार बार, राइट? सो मेक श्योर दैट यू आर टेकिंग केयर ऑफ दिस एज वेल एंड कंट्रोल योर शुगर्स, कंट्रोल योर क्रॉनिक मेडिकल कंडीशंस, राइट? फोर्थ थिंग, बहुत सारे लोग, शुभा, हम लोग देखते हैं आजकल कि थोड़ा सा सिम्टम हो गया, सेल्फ डायग्नोज, गो टू गूगल, ऑल ऑफ दीज सिम्टम्स आर सजेस्टिव ऑफ यूटीआई एंड टेक अ ड्रग ओवर द काउंटर, राइट? दे गो टू द मेडिकल स्टोर और मे बी ऑर्डर ऑनलाइन एंड दे बाय द ड्रग एंड टेक इट, एंड दे डोंट इवन नो दैट दे हैव टू टेक इट फॉर दिस स्पैन ऑफ टाइम, राइट? They just go ahead and buy it and just consume it, and maybe they are taking it for lesser amount of time. Okay, so इससे क्या होता है, they start feeling better within 2 days maybe, and they discontinue, right? What happens because of that is, because पूरा infection clear out नहीं हुआ है, they feel better for a while, and after that the infection develops again, so they have recurrent infections because of that, right? And हमेशा अगर गूगल ने मेरे को एक बार बता दिया कि ये ड्रग लेना है, यूटीआई हो गया, हर बार गए, इन्फेक्शन हुआ, वही ड्रग लिया, वही ड्रग लिया, दिस लीड्स टू एंटीबायोटिक रेजिस्टेंस. अगर एक बैक्टीरिया इस चीज, जैसे कि आप लोग, इफ आई गिव यू एन एग्जांपल, यू सी दिस इन योर कॉकरोचेस इनटू योर हाउस, राइट? यू हैव बीन अप्लाइंग द सेम हिट on the cockroach, and the cockroach has become more prone that it is just smelling all the hit and not getting killed because of it, right? So this same applies to your bacteria as well. If you're taking the same antibiotic and agar wo se heal nahi ho raha, it means it is not responding to that antibiotic, right? And which is why this is the high time that you go to your doctor, consult it. You would need to run down some tests, and after that you will be given a suitable antibiotic which will cure your UTI completely and not give you recurrent infections.
Okay. Thank you. They're very, very helpful. I know a lot of women suffer from recurrent infections, and we turn to the same medicine and we don't realize that we're getting resistant. So thank you. That's very helpful. Now let's talk about something that really isn't talked about much. And I think, 75% of women really suffer with pelvic pain, and they suffer with pain during sex. And yet they suffer in silence, and they think this is normal. They think everybody has to go through that. And I know that's not the case. So can you talk a little bit about painful sex, what the reasons could be?
Yeah, so thank you, Shubha, for me, coming up with this topic, because this is a very lesser talked about topic. Because many women which come to who come to our OPD, or who we see over online consultations, they are complaining that they have pain during or after intercourse, right? And because this has been traditionally ingrained into their mind that it's always painful after the first time, or you have to just let it go, it will get better after 2 to 3 attempts. It is not. Okay, so God has created penetration not only for recreation purposes, but also for for you to have pleasure out of it. Okay, so it's not only for the reproductive purposes basically. Okay, so it is definitely supposed to be painless and pleasurable. Okay, and if you are recurrently observing that you are having pain during intercourse, you are observing that I am not feeling better out of it, I'm not gaining pleasure out of it, there is something seriously wrong, okay, which is happening, and you should come out and talk about it, because this condition is very, very common. Okay, so if I try and broadly divide it into two parts, it is called as number one condition which we see nowadays very commonly, and at proactive for her, because we have a specialized program for vaginismus. So this vaginismus is a condition in which the vagina, which is supposed to be a canal or a tube, okay, the muscles around it, they just shut off or do not allow anything inside, which could be a finger, a tampon, a menstrual cup, or a penis. Okay, and all of this is happening involuntarily. By that I mean the woman, maybe she's aroused, maybe she's wet, she wants to have the penetration, right? But the muscles, they are just so contracted that they're not allowing anything inside. Okay, and they're just shutting off and making it difficult for her to have penetration or painful penetration, right? So this condition is called as vaginismus, and this is also very, very common. But nowadays, because we see that still, talking about sex or intercourse, it's still a painful or a taboo topic. Many people are not coming forward and discussing this. But today, through this platform, I think, Shuba, we should, convey our message that vaginismus can be healed. Okay, this condition can be healed, and we at Proactive for Her can help you with this. We have a specialized program for vaginismus, in which we actually, deal with the physical and the mental health part of vaginismus and help you heal through that. Okay,
Yes.
talking about the second condition about painful intercourse is the dyspareunia. Okay, which itself means, the word itself means painful intercourse. Okay, it could be because of multiple reasons. So if a person have had surgery near that genital area, right? So if they have had an episiotomy during childbirth, that could cause painful intercourse. Okay, if that has not healed properly, right? Second thing is endometriosis. So endometriosis is a pathological condition which happens inside the body of a woman, where the inner lining of the uterus, it grows outside of the uterus and anywhere, right? And that can also make her have, painful intercourse. Third thing is, if you have undergone any radiotherapy, any chemotherapy, and if that has led you to shrinking of that area, that can also make you have painful intercourse. Fourth thing is, if you have recurrent infections, right, that can actually erode the inner layer of the vagina, and that, if the intercourse happens, that is definitely going to be painful for you. Okay, and fourth is, if you have any pathological condition inside the uterus, like your fibroid, your polyp, etc., definitely it can make that condition more worse for you, right? So if it is, so the moral of the story, I think we all should take away a message from this is, if you're observing that you are having pain during intercourse or after intercourse, this is high time that you should not be dealing with it alone. Come to us, talk to us, we'll definitely find a solution for you.
Yes, great, great. Thank you. And I know we have helped so many women. So not just in our vaginismus program, but also in pelvic floor physiotherapy. There are many, many solutions and treatments for women to get help. And I think the important message that we're hearing from you, doctors, they do not have to suffer in silence. There is help. So that's great. Now, another topic that leads us to another reason for that pain you mentioned is some infection or STIs. Can you, what do we need to know about testing, how often we should do it, what we should do? Can you just talk a little bit about that? Because we don't hear enough, we don't get the right advice about STI testing and screening.
Absolutely. So STIs are sexually transmitted infections. Okay. So these are infections which can transmit from an infected person to an uninfected person through sexual contact. So that sexual contact can be vaginal, can be anal, can be oral, or can even be skin to skin contact. Okay. So some of the, viruses like the herpes or the HPV can also, transfer from one person to another through skin to skin contact. Okay, so which is why knowing about STIs is very, very important. So these STIs, how can you actually, make sure that you are, protected from it? So the number one thing which you can do is get yourself and your partner tested. So why, it is important for you and your partner to get tested, because there is, because many of the STIs which are commonly seen do not present themselves as symptoms to us, right? They will be running in your body, but they might not present as, recurrent UTIs, maybe pain in abdomen or any discharge, any lesion, etc. Okay, so you can be silently suffering and you can transmit that virus, or you can gain that virus without even knowing about it, right? So which is why it is more important that you and your partner should get tested. And why it is important for both of you to get tested? Because if one of the partners get tested and it comes negative, there is still a chance that the other partner who has not gotten himself or herself tested can transmit the infection to the other person, and still that person can get the infection. So which is why it is very important to get all of these tests done. Okay, so we recommend that if you are into a monogamous relationship, you should get these tests done at least once a year. Okay, if you do not present with any symptoms at all. Okay, but if you are with a if you are with multiple partners, every time before you engage with a new partner, make sure that you and your new partner are getting tested for STIs, so that you can prevent yourselves from the underlying infections you are about to introduce yourself to, right? So these are some of the guidelines which we suggest about getting tested for STIs. And the STIs, people think that, oh my god, that would be such a complicated test. The name itself is so complicated. But I would like to tell you here that it's just a simple blood and urine test. Okay, you don't have to get any other test done. Okay, it's just like a simple sugar or CBC test. You gave your blood sample for, and you have to give your urine sample. That's it. And all the STIs which are very commonly transmitted, 6 of them are very common, and you can absolutely get yourself tested for the same.
Yes. Okay. That's very helpful. So if you're sexually active at least once a year with a new partner, both get tested. So
Yes.
Are there any symptoms at all for women? Would they have any symptoms? For some women, do they present as symptoms at all?
Yes. So as I said, the most common symptoms are no symptom at all. Okay. So if you are observing any symptom, like if you have, supposedly recurrent UTI, which are not getting away, that could also be pointing towards UTI. Second thing is, if you have any vaginal discharge, if you have any lumps, bumps, sores, which appear over your vulva, over your inner thighs, over your upper abdomen, lower abdomen, that could also be indicated. If you have any rash, if you have any if you have recurrent bleeding through your cervix, okay, or if you have intermenstrual bleeding. By that I mean, you get your periods maybe 30 cycles, in 30 cycles, and in between that also, if you have bleeding or spotting, that would also be indicative. Another thing is, painful intercourse is also indicative of STI, and that should not be ignored, and that could present as the only symptom, and you should get yourself tested for that.
Okay, great, great. So I think we're hearing that we must be proactive about our health. And so, in that vein, I want to talk about cervical cancer. Now, cervical cancer is the second most common cancer amongst Indian women today, and yet it's so preventable, right? So, can you tell us what we should do to prevent cervical cancer and when?
Yeah, I think this is the question of the hour. I think, yeah, we all should know about cervical cancer and the vaccine. Someone also mentioned in the comment section that they wanted to know about HPV. So I would definitely elaborate over that. So as Shuba correctly said, the cervical cancer is the second most common cancer which we see in women in India. And the strange part about this is we can definitely prevent it. Okay, or we can detect it even before it converts into a cancer. Okay, so which is why this your role actually comes into part, right? So cervical cancer is caused by a virus called as HPV, or human papilloma virus. And there has been a vaccine which has been developed against this HPV. So there are two kinds of vaccines which has been developed. One is Gardasil 4 and the other is Gardasil 9. The 4 and the 9 number indicate the strains against which it is going to give you protection. Okay, the more the better, because it is also going to protect you against genital warts, anal cancer, penile cancer, oral cancer as well. Okay, so which is why because HPV also leads to all of that, right? And this vaccine, it is actually advised to start from 9 years old. Okay, and the Gardasil 9, which I mentioned, is a gender neutral vaccines, which means that any gender can go ahead and take this vaccine. Now people will ask me, why, I don't have a cervix, why would I take the vaccine? Because, as I said again, it can also protect you against anal cancer, penile cancer, and which is why it is definitely recommended for both the genders, right? And nowadays government has also approved to use it even if you are sexually active, because it has shown to be similar in efficacy even if you take it after becoming sexually active. And the vaccine is to be taken in 3 doses. So supposedly, if you take the first vaccine today, you have to take the second dose after 2 months from today, and the third dose after 6 months from today. Okay, that's it. And within 6 months, you are going to protect yourself from cervical cancer. Okay, and that is really amazing to know, right? And many people aren't still aware of it. Okay. And the second thing which we can do to prevent ourselves from cervical cancer is getting ourselves tested for pap smears, right? So basically, pap smear is a screening technique which we do to actually evaluate whether there is any precancerous changes happening or not. Okay. And it has to be done just once in 3 years. Okay. If it is normal. And that's, I think, absolutely economical and absolutely the best way to go ahead and protect ourselves from cervical cancer.
Great, great. And this vaccine is for life, right? Is that correct? The Gardasil
Yes,
vaccine is
yes,
protection for
yes,
life.
yes, 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 definitely. It is protective for life. If you take it once, you are going to, have the antibodies throughout your life.
That's great. And is another reason for men to take the HPV vaccine so they will prevent in their transmission to women?
Sorry, I missed your question. Shubha, can you
Uh,
repeat?
Sorry, my question is another reason for men to also get vaccinated so they will not transmit it to women? Is
Yes,
that?
yes, yes. Because basically, when I am taking, supposedly a man takes a vaccine, okay, or a penile owner takes a vaccine, he will also not carry HPV, the virus, okay. So he is definitely not going to give the female partner or the vulva owner that that virus because of sexual contact, right? And she will not be exposed, and definitely she will not fall prey for this cancerogenic virus and will not turn her into having cancer maybe years later.
Okay, great, great. I think it's such an important vaccine, and there's not enough encouragement for women to take it. That's wonderful. Now, I wanted to move on to another topic I know you get a lot of questions on, and that's contraception. Now, I know there are some newer methods. You were telling us about some newer methods that women can consider and they can ask their doctor about that might be easier depending on the stage and time of their life.
Yes, 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 absolutely. Because whenever we talk about contraception, people have only 2 to 3 options. Like, they are talking about either the pills, because those are advertised more, and the second thing is copper tea. Okay, because it is another more commoner, thing which we get to hear from our peers, right? So they think that these are the only two options available. Okay, but there are some newer methods also available. I'll switch to Hindi a little bit because there is demand in the comment section.
Yes, please.
So जब भी हम लोग गर्भ निरोधक के बारे में सोचते हैं, हम टीवी पे बहुत अक्सर ये एडवर्टाइजमेंट देखते हैं, जो गर्भ निरोधक गोलियां हैं उसके बारे में, या तो फिर कॉपर टी, बिकॉज आजू बाजू में हमारे बहुत सारे ऐसे लोग होते हैं, नेबरहुड में ऐसे लोग होते हैं जिन्होंने कॉपर टी या तो पहले लगवाई होती है या कुछ साइड इफेक्ट्स होते हैं, वो डिस्कस करते हैं, राइट? बट हमें ये जानना बहुत ज्यादा जरूरी है कि हमारे पास और भी ऑप्शंस हैं, जैसे कि जो हार्मोनल पिल्स है उसके अलावा हमारे पास नॉन हार्मोनल पिल भी है, और ये आजकल बहुत कॉमन है। नॉन हार्मोनल पिल्स के साइड इफेक्ट्स हार्मोनल पिल्स से बहुत ज्यादा कम है, ठीक है? और ये आपको बहुत कम बार भी लेने हैं, जैसे सिर्फ हफ्ते में 2 बार लेने, ठीक है? और ये करने से वो आपको सिमिलर इफेक्ट देने वाला है जो आपको हार्मोनल पिल से लेने, यानी 21 दिन वाली दवाई से लेना है, ठीक है? सो अगर आप उस कैटेगरी में फिल आउट होते हैं, ठीक है, तो आप डेफिनेटली इन सारे ऑप्शंस के बारे में सोच सकते हैं, ठीक है? और बहुत सारे लोगों को गोलियां खानी पसंद नहीं है, मैं रोज भूल जाती हूँ, या फिर कभी याद रहता है, 2-3 दिन भूल जाती हूँ, फिर नहीं लेती हूँ, या तो मुझे बहुत साइड इफेक्ट होता है, या पीपल कम टू अस, दे टेल अस दैट विल आई गेन वेट आउट ऑफ इट, राइट? एंड will it affect my fertility, right? So if they have all of these issues, they don't want to go towards something which is oral, और अगर कोई दवाई नहीं लेना चाहते तो वो कॉपर टी ही एक दूसरा ऑप्शन सोचते हैं। बट बहुत सारे ऐसे ऑप्शंस हैं हमारे पास, जैसे कि इंजेक्शंस हैं, ठीक है? ये इंजेक्शंस आप 2 महीने में एक बार या 3 महीने में एक बार लगवा सकते हैं, डिपेंडिंग आप कौन सा इंजेक्शन लगा रहे हैं। और हमारे पास एक नया मेथड भी है जिसे इम्प्लांट कहते हैं, ठीक है? तो ये इम्प्लांट जो है, ये हॉर्मोन्स से भरा हुआ एक रॉड होता है जो आपके फोरआर्म पे लगाते हैं, ठीक है? और ये आपके बॉडी में 3 साल तक के रह सकता है। सो इट कैन स्टे इन योर बॉडी फॉर 3 years एंड इट कंटेन्स हॉर्मोन्स. And the best part about it is it does not come with the side effects which the oral contraceptive pill is going to give you. So अगर आपको दवाई खाने से कोई साइड इफेक्ट मिल रहे हैं तो वो आपको ये रॉड लगाने से या इम्प्लांट लगाने से नहीं मिलेंगे। And it's very very common in the outside of India. The Indians are still not going towards this method because of the because of probably not knowing about it, right? And this is very, very safe. Okay, you don't have to actually take a tablet every day or forget taking tablet. Okay, you just have to get it inserted. और ये इतना बड़ा प्रोसीजर भी नहीं है कि आपको ऑपरेशन रूम में लेके जाना पड़ेगा या एक पेट काटना पड़ेगा, ऐसा भी कुछ नहीं है. आपको सिर्फ एक छोटा सा निक देंगे और वहां से वो रॉड इंसर्ट करेंगे, एंड उसके बाद आपको पता भी नहीं चलेगा कि वो कहाँ डाला गया है. वो अपना अपना काम करता रहेगा, एंड वो 3 साल तक के अंदर रह सकता है. उसके बाद आप निकाल के दूसरा भी लगवा सकते हैं, या यू कैन स्विच टू अनदर मेथड डिपेंडिंग अपॉन दैट. But the takeaway message from here is that we have multiple options. Like, this is called as cafeteria approach. I have multiple options for you. You come to me, you tell me your contraceptive needs, and definitely I can offer you best of the methods which are suitable for you according to your health condition. Right? So, इसीलिए hesitate ना करें. अपने गायनेक के पास जाएं, उनके पास खुल के डिस्कस करें कि मुझे मेरा ये कॉन्ट्रासेप्टिव नीड है, मुझे इस चीज के लिए कॉन्ट्रासेप्टिव चाहिए, इतने साल के लिए चाहिए, मेरे ये हेल्थ कंडीशन है, मुझे ये साइड इफेक्ट्स हो चुके हैं, एंड हम आपके लिए डेफिनेटली दूसरा ऑप्शन, बहुत अच्छा ऑप्शन जो आपके लिए सुटेबल है, वो बता सकते हैं.
That's a great message. There isn't one size fits all. We hear a lot about contraception, and we just think if somebody else has the same side effect, then we will have this effect, and somebody else will agree, the same way. So I think that's important. It's very personal, very, very personal. So thank you for that. I want to talk about another area where there's a lot of misinformation, I think, and that's emergency contraception. So there's misinformation and there's misuse, and I think it's because we're not taught how to use it properly, and I know that can lead to dangerous consequences. So maybe you can help us understand what is the role of emergency contraception and how it should be used, and with the doctor's advice, I presume.
See, I think a very, very important question, Shuba, and people in the audience should know about it. Why? Because emergency contraceptive is meant to be plan B. Okay, by that I mean that if your plan A fails, then and then only you can go ahead with plan B. Okay, and which is why it is meant to be emergency contraceptive. So it was developed in a way that if your contraceptive method fails, or if your condom breaks, or if you forget to take pill for maybe 3 days at a stretch, and the intercourse happens, okay, unprotected intercourse happens, then you should be using this emergency contraceptive pill. Okay, and this emergency contraceptive pill has almost 5 times more higher dose of the hormone than the usual pill. Okay, so if you are taking it one time, so you're definitely exposing your body to much more level of hormones. And if you're taking it on an emergency purpose, that's okay. But if you're taking it every fortnightly or maybe every alternate day, that is definitely going to actually hamper the menstrual cycle, the hormones which are running your menstrual cycle, and it can make your menstrual cycles go irregular. Okay, and which is why, and you can have the side effects of the hormone. You can have mood swings, you can have breast tenderness, you can have abdominal upset, you can have nausea, vomiting sensation, etc., and that can definitely make your life a little more bitter. So definitely, if you're needing to take the pill for so frequently, make sure that you need a regular contraceptive pill or maybe a contraceptive method. You talk to your gynaec about it. They'll definitely suggest you the one which is less harmful for you and more user friendly. Okay, so which is why just don't overindulge into emergency contraceptive pill. It is meant to be for emergency purposes, and let's use it for that purpose only.
And doctor, you have to use it pretty soon after you had potentially unprotected sex or a failure.
Yes. So it is only effective if you take it within 72 hours of the unprotected intercourse, and it is most effective if you take it within 24 hours of the unprotected intercourse.
Okay, thank you for that. And now we're talking about those different forms of contraception, we have to remember that that's not practicing safe sex if we're with non-monogamous partners, right? So what are some good safe sex practices that women should always kind of keep in mind?
Yeah, I think because sexual health is itself a topic that people, don't want to talk about, or it's definitely a hush hush topic still. I would like, to actually introduce you to all those methods which you should take into consideration when you are thinking about safe sex practices. Okay, so whenever I talk about sex practices, I actually talk about 4 C's. Okay, so मैं आपको सेफ सेक्स प्रैक्टिसेस यानी कि आप सेक्सुअल कॉन्टैक्ट के दौरान या उसके बाद भी इन्फेक्शन से या कोई और रिप्रोडक्टिव चैलेंजेस से दूर रहने के लिए आपको कौन सी ऐसी चीजें फॉलो करनी चाहिए जो कि आपको ये सारी चीजों से उनका बचाव कर सकती है। तो इसके लिए मैं आपको कुछ चीजें बताने वाली हूँ। सो व्हेनेवर आई टॉक अबाउट इट, इट्स अबाउट 4 C's. So number 1 C is consent. Okay, so whenever you talk about intercourse or basically sexual intimacy, make sure that you have given your consent to it. Okay, and if the consent is not given under any influence of drugs or alcohol maybe, or it's not in the pressure of your peers कि सब कर रहे हैं तो मुझे भी करना है. Okay, it should not be like that. You should be wholly and solely agreeing that okay, I want to go ahead with sexual intimacy and I want to go ahead with it. ओके, तो कंसेंट सबसे ज्यादा जरूरी है। अगर आपको खुद से लगता है मन से कि मुझे सेक्सुअल इंटरकोर्स में इंडल्ज होना है या किसी से सेक्सुअल इंटिमेसी बनानी है, तभी और तभी आप इसमें जाएं। और कंसेंट दोनों तरफ से आना चाहिए, दोनों पार्टनर से, ठीक है। और कंसेंट ऐसा नहीं है कि एक बार दे दिया तो बस हो गया। अगर आपको कहीं पे भी बीच में ड्यूरिंग सेक्सुअल इंटिमेसी लगता है कि बस नहीं, अब मुझे अच्छा नहीं लग रहा है या मुझे नहीं जाना है, ओके, तो डेफिनेटली यू कैन स्टॉप इट at that point of time. Okay, so make sure that you have given the consent, or if you have taken or seek the consent for the same. Okay, and it's not implied कि भाई हाँ हो गया, मैं कर रहे हैं, तो implied consent नहीं होता है. It's always better to have a verbal consent. Okay, that you talk to your partner कि हाँ, are you going to do, can we go ahead with this? Okay, and then only you should go ahead with sexual intimacy. Okay, second C stands for communication. Okay, so communicate about what your needs are. Okay, what do you like into sexual intimacy? Okay, communicate about your desires. Okay, second thing which is important and communicated should be about sexually transmitted infections. अगर आपको लग रहा है कि आपको या आपके पार्टनर को सेक्सुअली ट्रांसमिटेड इन्फेक्शंस के कोई सिम्टम्स हैं, जैसे कि बहुत सारा वजाइनल डिस्चार्ज हो रहा है, या बहुत सारा यूरिन का डिस्चार्ज, यूरिन का इन्फेक्शन हो रहा है, या तो कोई रैश आ गया है नीचे, राइट, या तो फिर अब्डोमेन में पेन हो रहा है, उनको बुखार रह रहा है बहुत दिन तक, ठीक है। सो यू टॉक अबाउट इट टू योर पार्टनर, बताएं अपने पार्टनर को कि मुझे ये सब हो रहा है। आप दोनों जाके टेस्ट कराइए, अगर कुछ इन्फेक्शन आता है तो उसका ट्रीटमेंट पॉसिबल है और वो ट्रीटमेंट ले, ठीक है। तो डेफिनेटली कम्युनिकेट, एंड यू शुड ऑल्सो बी कम्युनिकेटिंग अबाउट गेटिंग टेस्टेड. बोथ ऑफ योर पार्टनर्स शुड गेट टेस्टेड अबाउट फॉर द STIs as we discussed earlier, right? थर्ड C is contraception. Okay, तो contraception बहुत ज्यादा जरूरी है, right? So whenever you are going ahead with intimacy, talk in the communication part itself, talk about the contraception whichever you are going to use. Okay, and the best form of contraception जो आपको protect करने वाला है STI से is condoms, or the barrier form of contraception. दूसरे जो है जैसे कि pills है, या injections हैं, या आपके implants हैं, या तो आपके copper T है, ये आपको STI से protect नहीं करेगा, ठीक है। तो इसके लिए डेफिनेटली आप बैरियर फॉर्म ऑफ कॉन्ट्रासेप्शन यूज करें। कॉन्डम्स, मेल कॉन्डम्स आते हैं जो पीनाइल ओनर्स के लिए होते हैं, फीमेल कॉन्डम्स आते हैं जो वल्वा ओनर्स के लिए होते हैं, ठीक है। तो जो भी है, दोनों कॉन्डम्स एक साथ यूज ना करें, क्योंकि डेफिनेटली वो ब्रेक हो जाएगा एंड इट कैन मेक यू मोर प्रोन. वन ऑफ द पार्टनर शुड बी वेयरिंग द कॉन्डम एंड मेकिंग श्योर दैट इट हैज नॉट लीक्ड और इट हैज नॉट fallen off, so that should be taken care of, right? So contraception के बारे में सोचें, उसके बारे में डिस्कस करें, एंड अगर आपको नहीं पता है, आपको जानना है, तो आपके डॉक्टर से पूछें, right? Fourth C is cleaning. Okay, तो definitely whenever the intercourse happens or everything happens, nobody knows that how to go ahead with it. Okay, so number one thing which I would tell all the vulva owners is कि जब भी आप intercourse के बाद आप ये बात याद रखें कि you have to pass urine before and after intercourse. Why? Because as I said कि बहुत सारे bacterias exchange हो जाते हैं and UTI होने के chances बहुत ज़्यादा है. So if you make sure that you are passing urine before and after, so that you are flushing out the bacteria and you are not making yourself prone for UTI. Okay, so passing urine. Okay, then cleaning up that area. You don't have to just take a bath. You can clean the genital area with normal soap and water and keep it dry after intercourse, so that if there is any discharge exchange, you are just cleaning it up and it is not going into your symptoms, okay, or systems. Okay, so that is definitely important. So अगर आपको सेफ सेक्स प्रैक्टिसेस करनी या किसी को समझानी, ये 4 चीज जरूर याद रखें: कंसेंट, कम्युनिकेशन, कॉन्ट्रसेप्शन एंड क्लीनिंग. Okay, that's very, very important.
Great. Thank you. Thank you so much for that. I think we've got quite a few questions, Doctor.
Okay.
So I'm opening it up. I'll take some of the questions that we've heard from our audience. If you have more questions, please put it in the comment section. I think there are some questions around PCOS. While that's not exactly sexual health, I think it's so prevalent now, and we do a lot of work in PCOS. You, of course, are a PCOS expert, doctor. So do you want to talk a little bit about symptoms and when they should see a doctor?
Definitely.
If they suspect.
Yeah, because nowadays PCOS is so common that we see it in every one person amongst 5. Okay, so which means that it has become so common, and that is because of our lifestyle, right? So if we are into sedentary lifestyle, if you are not having a proper diet, if you are into too much of stress, or if you are not sleeping well, I think I'm talking about all of our lives. And if this is what is bothering you, then it can make you more prone for PCOS if you already have the gene for it. Okay, so, and which is why we observe that after lockdown, when all of us were into our homes, we were not that much active, and we were just trying out all the recipes which were allowed there on the YouTube. Many people who didn't have PCOS earlier, or they had regular periods earlier, now after that they started developing symptoms of PCOS. Okay, so the symptoms of PCOS which you all should be looking after is if you are having irregular or delayed periods. अगर आपके पीरियड जो हैं वो पहले रेगुलर थे, या अभी 2-2 महीने के बाद आ रहे हैं, 1 महीने में नहीं आ रहे, रेगुलर नहीं आ रहे, या 3-3, 4-4 महीने नहीं आ रहे हैं, तो पीसीओएस की तरफ इंडिकेशन हो सकता है. दूसरी चीज है इफ यू हैव हाइपर एंड्रोजेनिक सिम्टम्स, जैसे कि मुंह पे बाल आना, वो भी थिक कोर्स बाल आना, दाढ़ी के जैसे बाल आना. Second thing is if you have acne over your jawline, if you have hair fall, if you are observing hyperpigmentation behind your neck, in your arm folds, in your underarms, if you are observing any changes in your weight, okay, that is also indicative. Third thing is अगर आपका अल्ट्रासाउंड रिपोर्ट सजेस्ट करता है पॉलीसिस्टिक ओवरीज, दैट कुड बी इंडिकेटिव. अगर पॉलीसिस्टिक ओवरीज दिखा दिया तो इसका मतलब ये नहीं है कि पॉलीसिस्टिक ओवेरियन सिंड्रोम है, बट इंडिकेट हो सकता है. तो अगर इसमें से कोई भी सिम्टम आपको लग रहा है कि आपको है, या फिर आपको बहुत बार सता रहा है, definitely go ahead and speak to your doctor. We will help you diagnose whether this is PCOS or not. And most of the people who have PCOS, they can heal through lifestyle change, and we can help you with that.
Okay, great. I'm seeing some questions around the pap smear. I know you mentioned it earlier. Can we just refresh everybody's memory, reiterate how often they should get the pap smear?
Okay.
All women.
Yeah, all women, all people who have cervix or mouth of the uterus or vulva owners, I think you should go ahead and take pap smear. So pap smear is a screening technique. ये एक ऐसी जांच है जो आपको कैंसर होने वाला है या नहीं होने वाला है, ये शायद आपको 7-8 साल पहले ही बता सकती है, या तो फिर कैंसर की जो पहले की स्टेज है वो आपको पहले से बता सकती है. ठीक है, तो ये जांच में क्या करते हैं हम, जो आपके यूट्रस का जो पार्ट है, सर्विक्स, वहां से थोड़ा सा पानी निकालते हैं और उसे माइक्रोस्कोप के नीचे चेक करते हैं. ठीक है, एंड वी कैन डिटेक्ट वेदर दिस हैज कैंसरस सेल्स और प्री कैंसरस कंडीशन और नॉट. एंड इफ that is completely negative, then you should be doing this every 3 years. और जो लिक्विड बेस्ड साइटोलॉजी है, जिसमें हम लोग साथ में इफ यू हैव प्रेजेंस ऑफ एचपीवी वायरस और नॉट, अगर उसमें एचपीवी वायरस आपके सर्विक्स के अराउंड भी है या नहीं है, ये भी अगर हमें डिटेक्ट करना है तो ये भी हम लोग डिटेक्ट कर सकते हैं विद लिक्विड बेस्ड साइटोलॉजी. एंड अगर आप ये डिटेक्ट कर रहे हैं, देन यू शुड, एंड इफ दैट इज कमिंग नेगेटिव, देन यू कैन रिपीट इट एवरी 5 years. Okay, so talk to your doctor about it, which test you want to get yourself done for, and they'll advise you how often you should be doing it. Okay, and I don't think there should be a hesitation in getting one done.
Great, great. Okay. And I think there's a lot of questions around the vaccine. Can you just say the age, a starting age, from what age to what age a woman can take, or a man can take, and a man should take the vaccine?
It should be started at the age of 9, okay, as early as 9, and it can be taken by women till the age of 45 years of age. Same for men, okay. So this is the recommended age by the government and the WHO, that you can start it at the age of 9 and take it till the age of 45.
Okay, great.
Even
So
though
that's
you're sexually active.
okay, wonderful. Just looking at some other questions. There are some questions around the contraception discussion we had. So the one you inject in your forearm, what is the name of that, doctor?
The injection, the implant which you insert on
Implant.
your forearm is called as implanon. Okay, implanon. And वो over the counter available नहीं है, आपको दुकान में जाके नहीं मिलेगा. You should go ahead and talk to your doctor. Not many of the doctors are practicing it, but we at Proactive for Her are definitely providing you the same. Okay, so if you are in Bangalore, you can visit us physically and you can get one done, or you can reach out to your gynecologist and ask if they can offer you implanon, and that procedure can be done for you.
Okay, great. And I think it's important to mention that we do practice all over India online.
Yes.
So that's important. Now, the name of the vaccine for HPV?
Yes, as I said, it is Gardasil 4 and Gardasil 9. If you want me to spell it, I can do that. So it is GUARDASIL. And the number 4 and 9 indicate the number of strains against which it is going to give you protection. ओके तो इस वैक्सीन का नाम गार्डासिल 4 या गार्डासिल 9 है. ये नाम से आप सर्च कर सकते हैं. और मुझे बताने में बहुत ज्यादा खुशी हो रही है कि हम लोग प्रोएक्टिव फॉर हर में आपको आपके एट होम वैक्सीन सर्विस भी करा रहे हैं. तो अगर आप टियर 1 या टियर 2 सिटी में रहते हैं, यू कैन जस्ट विजिट आवर वेबसाइट एंड यू कैन जस्ट क्लिक ऑन योर लोकेशन वेदर दिस इज सर्विसेबल और नॉट. हम वहां पहुंचा पा रहे हैं या नहीं पहुंचा पा रहे हैं वैक्सीन, एंड वी कैन डेफिनेटली ऑफर यू at home vaccination for sure.
That's right. Very, very important. Now, one last thing I wanted, just another reproductive and gynecological cancer that we didn't discuss, which is the most common, which is breast cancer. Now, we hear a lot more about breast cancer, but I think what I also hear from women is that mammograms, which is the screening method, you can talk a little bit more about that, but what I hear from women is that they think it's painful, so they don't want to do it. They're scared to do it. And I want to say, as somebody who's had several mammograms, that it's less painful than getting your eyebrows threaded. And as women, we do that all the time. We don't even think twice about it, yet people are worried about a mammogram, and it's so important. So do you want to talk a little bit about when we should get mammograms and how important it is for women for breast cancer protection?
Yeah, that's a perfect example, I think, Shuba, that it is less painful than getting our eyebrows done, right? So whenever you think that you have a family history of breast cancer in your first degree relatives, यानी कि आपकी फर्स्ट डिग्री रिलेटिव्स में किसी को अगर ब्रेस्ट कैंसर है, जैसे कि आपकी मम्मी, आपकी बहन, आपकी मौसी, आपकी बुआ, इनमें से किसी को अगर ब्रेस्ट कैंसर डिटेक्ट हुआ है तो आपको होने के चांसेस ज्यादा हैं. तो इन केसेस में यू शुड स्टार्ट विद स्क्रीनिंग एज अर्ली एज द एज ऑफ 35. 35 की उम्र से आपको शुरू करना है डिटेक्ट करना स्क्रीनिंग टेक्निक फॉर ब्रेस्ट कैंसर. ओके, और मैमोग्राम अगर आपको नॉर्मल आता है देन यू शुड डू इट एवरी ईयरली. ओके, और अदर वुमेन जिनके घर पे हिस्ट्री नहीं है, उनको एटलीस्ट यू शुड बी स्टार्टिंग एट द एज ऑफ 40. 40 की उम्र से शुरू करना है. ओके, एंड सेम यू हैव टू गेट इट डन एवरी ईयरली. एंड आप घर बैठे बैठे क्या कर सकते हैं अगर मेरी एज 40 नहीं है अभी, राइट? सो व्हाट कैन आई डू टू डिटेक्ट वेदर आई हैव अ लंप और नॉट? यू डू योर सेल्फ ब्रेस्ट एग्जामिनेशन. ओके, यू हैव टू डू इट एवरी मंथली. just a week after your periods, and you can do it at the comfort of your home. And if you detect anything abnormal in that self-rest examination, just visit your doctor and you can diagnose that cancer at a very early stage. Okay, and if you want to know how can you go ahead and get do your self-rest examination, go and check our YouTube channel, Proactive for Her. There is a video how to go ahead and get your self-rest examination done. उसको देखें, वो वीडियो देखें और वैसे ही परफॉर्म करें, एंड डेफिनेटली आप शायद एक ब्रेस्ट कैंसर ढूंढ के निकाल सकते हैं.
Great, great. I think that's very, very important. In cancer detection, time is of the essence, right? So the earlier we detect it, in case there's any issue, the earlier we can address it. So I think that's very important. Doctor, there are some questions around birth control methods, maybe the implant or IUDs or other copper T implantation, and do they affect fertility or ovulation in the long term? Maybe people are concerned about that a little bit.
फर्स्ट ऑफ ऑल ये मैं कंफ्यूजन आप सबके दिमाग से हटाना चाहती हूँ कि कॉन्ट्रासेप्शन का महत्व ये है कि हम प्रेगनेंसी से खुद को बचाएं, ना कि आगे होने वाली प्रेगनेंसी से हमेशा के लिए आपको रोके. ठीक है, तो ये जो भी मेथड्स हैं, जैसे कि जो दवाइयां हैं आप 21 दिन के लिए लेने वाली, द ओरल कॉन्ट्रासेप्टिव पिल्स विच आर टेकन फॉर 21 days, और द नॉन हार्मोनल कॉन्ट्रासेप्टिव पिल्स और कॉपर टी और इम्प्लिनॉन or your injections, they are not meant to affect your fertility. Okay, वो आपकी reproductive capacity को कम नहीं करते. They just make sure, they act in a very different way, right? They just make sure that the ovulation is not happening in some of the cases, or the sperm is not meeting the egg, or even if they meet, they are not just getting form into fertilization, or they are not getting implanted. या तो उसका बच्चा तैयार नहीं हो रहा है, या तो बच्चा तैयार हो रहा है तो चिपक नहीं रहा है या बढ़ नहीं रहा है. ये उसका मैकेनिज्म ऑफ एक्शन है, और ये इन सब से और इन सब का कोई भी साइड इफेक्ट नहीं है कि आपकी आगे की जो रिप्रोडक्टिव लाइफ है उसको अफेक्ट करे. ठीक है, एंड जस्ट टू योर सरप्राइज, ऑल ऑफ दीज मेथड्स, इफ यू ट्राई एंड रिवर्स इट, like if you take out a copper T, or if you just put yourself off an oral contraceptive pill, you can regain your contraceptive capacity within 2 to 3 months of stopping that. Okay, so that is such a useful method, right? तो ये आपको जानना बहुत ज्यादा जरूरी है. सो इससे डरे नहीं, अपने डॉक्टर से पूछें, आपकी कॉन्ट्रासेप्टिव नीड बताएं, उनसे आपके लिए बेस्ट कौन सा सुटेबल है ये जाने, और उसके फॉलोअप के लिए क्या क्या जरूरी है ये भी डेफिनेटली जाने.
Great, great. I think that should clear it up. I think we have another question on the vaccines, and I'm actually quite thrilled that people are so interested in it, because it is such an easy way to prevent such an important cancer that none of us obviously want. So I think that's wonderful. There, somebody's asking about, do you need a test before you get vaccinated?
For your all knowledge, there is no test needed before you get yourself vaccinated. Okay, so कोई भी टेस्ट की जरूरत नहीं है. अगर आप सेक्सुअली एक्टिव हैं या नहीं एक्टिव हैं, अगर आपको उस चीज का एक ही सिर्फ कॉन्ट्राइंडिकेशन है उस चीज के लिए, अगर आपको उस वैक्सीन की एलर्जी है, उसके कोई भी प्रोडक्ट से एलर्जी है, तो फिर वो कॉन्ट्राइंडिकेटेड है. अदरवाइज देयर इज नो कॉन्ट्राइंडिकेशन टू टेक द वैक्सीन. ओके, सो अगर आप कोई भी इम्यूनो डेफिशिएंट कंडीशन पे है, या आपको HIV डिटेक्ट हुआ है, एड्स है, इवन देन you are eligible to take the vaccine.
Great, thank you. And I know there were some questions about how to take the vaccine at home, and Proactive for Her does offer that service all over India through our partners. If you go to the proactiveforher.com website, under diagnostics, you will be able to find that. Just seeing if there's any other questions. There were some questions around, there is a question around vaginal burning. If somebody has vaginal burning, what do you advise them to do?
It depends upon the age of the patient and what are the associated symptoms with it. Okay, so if you are in the reproductive age group and if you have infective symptoms along with it, it could be suggestive of infections or STIs, as we discussed. If it is happening during or after intercourse, it could be indicative of vaginismus, and you should be talking about it. If you are into perimenopause or menopausal age group and if you are observing vaginal burning, it could be because of atrophic vaginitis, which is one of the condition which happens after menopause. And in all the cases, reach out to your doctor. They'll help you diagnose better and they can suggest you the best treatment for the same.
Okay, excellent. Well, I think we're just about out of time, Doctor. So I just want to say I'm really grateful to Policybazaar for giving Dr. Ankita and me the opportunity to speak to you about sexual health. It's so important. We just don't hear enough about sexual health for women. And I think we heard a lot from you. We heard a lot about, we don't have to suffer from painful sex. There is help available. There are new contraception methods, and we should be able to ask our gynecologist about it. Cervical cancer, very, very preventable with an HPV vaccine for both women and men. I love the 4 C's for consent and safe sex practices. I think that's something all women should keep in mind. And of course, for any PCOS concerns, can also come to Proactive. So thank you, Doctor. This is certainly enlightening for me, and I'm sure very enlightening for the audience. Thank you so much.
Thank you so much. Thank you, Shuba, and thank you, Policybazaar team, and thank you for having me. All the audience is so lovely, and I think if we are not able to connect here, if you have some specific questions, you can reach out to us on Proactive or her website, and definitely over one-on-one consultation, we'll be able to solve your specific issues for sure.
That's right. Thank you. Thank you, Dr.